My mother and father immigrated here from Haiti about 40 years ago. Haiti is one of the poorest countries in the world. From an early age, my mother always talked about the need for equality and the issues related to not having access to healthcare in Haiti. And she's a nurse, and every day she would come home telling us stories about patients in the hospital and how much fulfillment she got from taking care of patients. And so I always wanted to help people and make people feel better. And when I got to college, it was a natural transition for me to major in the sciences, which I gravitate to, and to go into medicine, because I believe it's the noblest profession. It's such a personal relationship that you have with patients, and they trust you with their health. And it's just an honor for me to be a physician. Dermatology is very unique in that you are able to take care of patients of a wide variety of ages, and you see a wide variety of illnesses like acne and eczema and skin cancer. So we take care of very sick people, but also very healthy people. And we make people feel better because you can see, the improvement, and it's instant gratification, and it's very rewarding, when someone comes in and they feel better about themselves because you made them look better, and when they look better, they feel better.
I knew at an early age that I wanted to be a physician, but it wasn't actually until medical school that I discovered dermatology and realized that there was a huge need to take care of people that looked like me. Now that I'm in dermatology, it's even more gratifying because I see how patients respond to me, how they're excited that someone is there that understands their unique concerns and the conditions that they face.
I wanted to be a writer. I was really interested in science and maybe just being a pure scientist. And I was interested in architecture, sports, all sorts of stuff. But then I found that medicine actually brought through a lot of different elements of society. So even now as a physician, I'm writing and I'm thinking like a scientist, and I have a laboratory and involved in clinical trials. And being able to use a lot of creativity to help for a common mission to advance patient care. If you're really interested in elements of internal medicine, then you can get that in dermatology. There's so many very complex medical diseases that we manage. And if you're interested in cosmetics, you have options. If you're interested in surgery, there's Mohs surgery. If you're interested in pathology, there's dermatopathology. So really, dermatology is a microcosm of all of medicine.
I love being in dermatology because I think it's a very innovative field. There's a lot of room for creativity and new initiatives. But I also love it because I think most people are accepting of that change and are excited and are open to embrace it.
I am the youngest sister of someone who has something called nevus avota. My older sister has a green birthmark that covers one side of her face. So growing up, there were a few things that I was exposed to. My pediatrician, as well as the local dermatologist. This local dermatologist was a Black woman. She was smart, and she would update us on the science of what could help my sister in the future. But because of my sister's brown skin tone, the lasers at the time would do more damage than good. And of course, it would be devastating. And my sister would be so upset that, science hadn't quite caught up to what her brown skin really needed. But somehow that dermatologist, Dr. Yvonne Knight from my hometown in Richmond, Virginia, always found a way to instill confidence in my sister before she left. And year after year, I took note of that. And I really realized, wow, this is a different type of doctor, and I definitely want to be part of that type of medicine.
I'm from North Philadelphia, an inner city neighborhood where diabetes, hypertension, cardiovascular disease were all rampant. And I wanted to make a difference and treat those patients. I got a little sideline. During fourth year of medical school, I took a dermatology rotation and loved everything about it. The pathology was different. You could see the rashes. And I thought, I can still serve the underserved in the specialty of dermatology.
Once I got to medical school, I realized that dermatology was a way to reach people of all ages and backgrounds because the skin, hair, and nails are essentially a window to one's internal health. And I was fascinated by the fact that dermatologists could recognize unique signs and symptoms on the skin, hair, and nails and diagnose internal conditions.
I always tell people that I've wanted to be a dermatologist since I was 13 years old. I was first inspired by Dr. Errol Quintel, who was the first African-American dermatologist in the state of Louisiana. And he was a neighbor and friends with my parents and has become a mentor and a friend through the years. But as a young Black kid growing up who was smart in the South, you were sort of ushered into one of two careers, medicine or law. And medicine appealed to me because of the scientific aspect. And then dermatology appealed to me because of the artistic aspect. So it's a perfect marriage of the two interests. I really liked science and math and the fact that there was an answer and it was exact. But I also like to take a personal flair on things and add my own little color. And so all of the interests that I pursued as a young person sort of led me to this place. And I was the one who knew from the beginning of medical school that dermatology was for me. So every rotation, I would just check them off. Nope, not as good as derm. Nope, not as good as derm. And it worked out.